A lot of families in Long Beach think the Medi-Cal rules from 2 years ago still apply. That their parents' savings, their bank account, even their second car don't count anymore. That California got rid of all that. That actually changed on January 1st of this year. And families who don't know about it are heading toward a big surprise at their parents' next renewal that could affect their coverage and their care. So that's what this video is about. I'm Chrysler, and this is Right at Home Long Beach, where we talk about senior care, aging, and how to help people you love stay safe and independent at home. So let's start with what actually happened. From 2024 into 2025, California had eliminated its asset limit for Medi-Cal, which meant that for roughly 2 years, seniors could qualify for Medi-Cal, including the programs that cover long-term care, without the state looking closely at what they had in their bank account. That was a huge deal, a big deal. A lot of families made decisions during that window based on that rule. But effective January 1st, 2026, the California Department of Healthcare Services reinstated the asset limit for most of these programs, specifically for the non-modified adjusted gross income programs, which is the category that covers seniors and people with disabilities who rely on Medi-Cal for things like home care and nursing facility coverage. So the new limit is $130,000 in countable assets for a single person, or $195,000 for a couple. And a 30-month look back on certain asset transfers started phasing in at the same time. Now, if you just heard those numbers and thought, okay, my parent doesn't have that much, we're probably fine. You might be right, but I'd still encourage you to watch the rest of this video, because the question isn't just about how much your parent has, it's what counts. So stick with me here, because this next piece is where most families get tripped up. Here's what most families don't realize. Not everything is counted. The primary home, the house your parent is living in, is exempt. It doesn't count toward that $130,000 limit. One vehicle is also generally exempt. Now, what does count are bank accounts, cash savings, a second property, investment accounts that are actively paying out, that kind of thing. So a family with a parent in a small condo in, let's say, North Long Beach with modest savings and a Social Security check, they're probably in good shape. But a family where mom sold the house to move in with them and that money is sitting in a savings account, that's a different conversation. And here's the thing about that look back period, which California is phasing in over the next 2 years, working toward 30 months by mid-2028. A look back means that the state can review asset transfers your parent or parents made going back a certain number of times. If assets were moved below fair market value, gifted to a grandchild, transferred to a relative, that could all create a penalty period for your Medi-Cal eligibility. So here's the reassuring part. Transfers made in 2024 and 2025, before the new rules kicked in, are fully exempt. If your family did any planning during that window, those transfers are protected. But anything going forward, starting in January 1st of this year, 2026, is subject to that review. And here's the part that surprises people, I find, every single time, because the timing of this affects more families than you think. So when does any of this actually hit? Current Medi-Cal enrollees, people who are already on the program, are not getting cut off immediately. The new asset test kicks in at their first annual review in 2026. Or if there's what the state calls a change in circumstance review, meaning something in an account changes that triggers a reevaluation. So if your parent renewed in January, they may already have been through this. If their renewal comes up in October or November of this year, you still have time to look at the picture clearly before that date. Here's what I'd recommend. Pull together a simple snapshot of what your parent has: bank accounts, savings, any property. Compare it against a $130,000 threshold and what's actually countable. If anything is close or unclear, talk to an elder law attorney or a Medi-Cal benefits counselor before the renewal date. That's exactly kind of planning that prevents a coverage gap. And I'll be honest with you about one more thing. The reason this matters for home care specifically is that the same Medi-Cal programs covering long-term care, including some managed care plans that cover in-home personal care, all flow through this same eligibility gate. If someone loses Medi-Cal, they lose access to those services too. Also, one more thing worth mentioning, because I think I've seen a lot of anxious headlines about this as I research about it. There are federal Medicaid changes coming in 2027, including new work and community engagement requirements for certain Medi-Cal enrollees. Now, I want to be clear, those requirements apply to adults 19 to 64 without children. Seniors, people 65 and older, are generally exempt. People with disabilities are also generally exempt. So if someone you know read something alarming about Medicaid work requirements and is worried about their parent losing coverage, reassure them. What affects seniors right now is the asset limit, which I just walked through. The 2027 changes are largely a different population. So I think that's a meaningful distinction to put out there. And I think it's important to say out loud because a lot of the coverage I've seen mixes these two things together in ways that possibly can create unnecessary fear. This is honestly one of the first things we may talk through with families when they call us, because Medi-Cal eligibility affects how care gets structured and paid for. Of course, if you're in Long Beach, Lakewood, Downey, or anywhere in the surrounding communities, and you want to walk through something like this with your family's situation, we're happy to have that conversation. Of course, I'm not a lawyer. We're not a lawyer. We're also happy to refer out to attorneys we know. As always, if this video helped clarify something, please hit like, share it, comment, subscribe. It genuinely helps other families find this information when they're searching for it. I'll see you on the next one.